The Youngevity UK and Europe Show with Dr. Wallach.
Hi, my name's Jonathan Smith. Welcome to the Youngevity UK and Europe Show with Dr. Wallach. Each week we'll go through the Dead Doctors Don't Lie show and handpick information regarding people's specific health concerns. So listen now as Dr. Wallach gives his expert advice on how to deal with the root cause of illness and disease nutritionally. If you would like further information on the products recommended in the show, they can be found in the description below the video. Enjoy the show.
The Youngevity UK and Europe Show.
I'm just finishing up a conference where I have to get points for my licensing in the states of Oregon and California. And one of the things they were talking about was these issues of things like Parkinson's disease, MS, Lou Gehrig's disease, ALS, and Huntington's disease, and so forth, and spinal paralysis, and these types of things. And much of what they were talking about when they were talking about all the rest of the symptoms these patients had, they really had osteoporosis of the skull. Okay? Osteoporosis in the skull can result in 25 different diseases. First signs, you're getting osteoporosis of the skull, begin to squeeze the 12 cranial nerves. The cranial nerve number 1, the olfactory nerve, you begin to lose your sense of smell. Can't smell food cooking, can't smell smoke in the fireplace or the barbecue pit anymore. And then you begin to lose your vision. And doctors look in your eyes, you don't have cataracts, you don't have macular degeneration, they take the pressure in your eye, and you don't have pressure problems in your eye, right? And so it's because the optic nerve is being squeezed. It's called optic nerve atrophy, ONA, okay, rather than glaucoma. And then let's see here, the third cranial nerve, when you put the light in your eyes, that's what doctors put a light in your eye to see if your pupil is going to contract. If the pupil either gets wider or just doesn't respond at all to the light, that's the third cranial nerve being squeezed. And then the fourth cranial nerve being squeezed, it kind of affects your sense of taste and so forth. The fifth cranial nerve, the trigeminal nerve, you get trigeminal neuralgia, and you get headaches and, again, tongue problems and pain in your face. And dentists love that. Oh, dentists love that because they will pull your teeth and give you dentures and implants and all kinds of stuff because they're going to tell you it's due to dental problems. And then when you have the sixth cranial nerve being squeezed, the muscles to the eye that move the eye around are losing its motor stimulus, and so that doesn't work very well. Then the seventh cranial nerve, you get Bell's palsy and your face droops and they think you had a stroke. And then the eighth cranial nerve, when it's getting squeezed, there's two main branches of the eighth cranial nerve. The auditory branch, you can gradually lose your hearing, you become deaf. And then, of course, you can also get tinnitus, ringing in the ears, or a tone in the ear, kind of like a thing or a whoosh, whoosh sound. And then when the vestibular branch of the eighth cranial nerve gets squeezed, you get vertigo, okay, or Meniere's disease. And then, of course, the ninth cranial nerve, your voice changes. You begin to talk like a little old person, or maybe even lose your voice completely, and you feel like you have a golf ball in your throat, because that's the glossopharyngeal nerve. It's the ninth cranial nerve, controls, again, your vocal cords. The 10th cranial nerve, the vagus nerve, oh my. You get coughing jags and hiccups, and they say, oh, you have COPD, chronic obstructive pulmonary disease. It's really the vagus nerve being squeezed, the 10th cranial nerve. You can also get rapid heart rate. They might even misdiagnose you as having AFib or atrial fibrillation or tachycardia, and they're going to give you heart medicine and implants and pacemakers and all that kind of stuff. And it's really the 10th cranial nerve being squeezed. And then you get gastroparesis when the 10th cranial nerve is being squeezed. And this is, very, very painful stuff, and lots of mucus in the stomach, bloating, and so on. And they will give you Nexium and this kind of thing, and they say you got acid reflux and so on. It's really just the 10th cranial nerve being squeezed, or they may even want to do surgery in your stomach. It's just the 10th cranial nerve being squeezed. When the 11th and 12th cranial nerve are being squeezed, you get problems with the motion of your head and ears and back of your neck and shoulders, because those muscles are innervated by cranial nerves number 11 and 12. And then, of course, the spinal cord, when it gets squeezed, as it's going through the foramen magnum, the big hole in the back of your skull where the spinal cord comes out, it gets squeezed, and you get tingling in the hands, and you get numbness all over. And they say, oh, okay, you got Parkinson's disease. You have Lou Gehrig's disease, ALS. You may have MS. You have Huntington's disease, and really it's just squeezing of that spinal cord. And you can go into just total paralysis from the neck down. And they're a little bit confused because they don't have all the other stuff that goes along with these other diseases, but they're going to give it that name because, insurance will pay for it and this, that, and the other. So I want you to contact your Youngevity associate, and, of course, you want to get a hold of the books. Let's Play Doctor. You want to get a hold of the book Epigenetics. You want to get a hold of the book Immortality. You want to get a hold of the book Rare Earths, Forbidden Cures, and get a hair analysis. See if you're absorbing. The hair analysis is worth doing a hair analysis just to see if you're absorbing. Chapter 11 tells you how to collect the hair, how to package it, where to ship it, and 2-3 weeks later you get the results, and then you will be able to read Chapter 11 again, tells you how to interpret it. Again, the main thing you're looking at is, am I absorbing? That will tell you. If all those numbers are down below the line, that means you're not absorbing. But let's say you have a bunch of other stuff going on. You say, oh, my gosh, that's why I've got osteoporosis of the skull, because all my minerals are messed up and so forth. And so you really, really want to go that direction. Of course, you need to take our program. We have what we call the Healthy Bone and Joint Pack. Throw in the MSM, the vitamin D3, the Glucogel, and one Healthy Bone and Joint Pack per 100 pounds of body weight. And then, keep going to the doctor until he says, I don't know why, but you don't have Parkinson's disease anymore. You don't have this anymore. You don't have that anymore. In fact, it may not have been those things. It may have just been osteoporosis of the skull. You give the body the raw materials. You give your skull the raw materials. It has the capacity and the machinery to heal itself.
The Youngevity UK and Europe Show with Dr. Wallach.
Thanks for listening to this week's show. If you're listening on YouTube, subscribe to the channel. And for more info on the products mentioned in this week's show, check out the links in the description.